here we are going to talk about the sign and symptom of abnormal electrolyte or imbalance of electrolyte. The first one, we're going to sodium. So first of all, we have to know what are the normal sodium level, or what are the normal body function of sodium. Then go for hyponatremia, causes, sign, symptom, right? And also hypernatremia, causes, sign and symptom. And as a LPN or RN, what is our responsibilities? What is the nursing intervention, right? It is very important. We should talk about this. So the normal sodium range is 136 to 145 milliequivalent per liter. 135 to 145, I said. So here I said the normal sodium range, I just write here 136 to 145. So if the sodium range is less than 136, it is hyponatremia easily. If the sodium is more than 145, it is hypernatremia. Even the baby who born today, he or she also know this. But my question, what are the function of sodium in the body? What is the function? The main function, maintaining the fluid balance in the body. Maintaining the fluid balance, or maintaining the normal function of the nerves or muscle function, right? Let me recap it. The function of the sodium in the body, maintain the fluid balance in body, or maintain the function of the nerves or muscle function, right? What are the source of sodium, my friend? The source of sodium are the salt or processed food. The salt is the most important source. So now here, hyponatremia, what are the causes of hyponatremia? We should know because of our profession. The major causes are GI or gastrointestinal fluid loss, right? Gastrointestinal fluid loss. What are the gastrointestinal fluid loss? Like gastrointestinal fluid loss, like vomiting, diarrhea, right? Also sweating, or use of diuretics. Diuretics are the hypertensive medication. Sometimes we use for high blood pressure, or we use for like reduce the edema, right? So if I say what are the skin losses, answer is the sodium. Sodium is the skin losses, skin losses of the sodium. Also, they said if gain of water, drinking too much water, or excess IV fluid like dextrose in the water. So let me recap it. I said if GI losses or diuretics, skin losses like sweating, or SIADH, endocrine disorder, right? syndrome of inappropriate antidiuretic hormone, SIADH, or edema or hyperglycemia. These are the causes. So what are the cause of hyponatremia? Means when the sodium level is more than 145, more than 145. So hyponatremia, the major cause are water deprivation or excess sodium intake, or if the kidney failure or some endocrine disorder like Cushing syndrome. Hyponatremia. Let me read it. Loss of fluid like insensible water loss, hyperventilation or fever, or diarrhea. Water deprivation. If anybody take excess salt or sodium, or excessive use of table salt, diabetic insipidus, heat stroke, because heat stroke, too much sweating, water loss, right? This is called develop hyponatremia. So sign and symptom. There are so many sign and symptom, right? If I make it shorter, hyponatremia patient finally develop confusion at the last. Confusion. Basically, confusion is more common in elderly person. Muscle cramping, fatigue, nausea and vomiting, headache, all are the signs of hyponatremia. Let me recap it. I said the sign symptom of hyponatremia are lethargy, confusion, anxiety, muscle twitching or cramping, abdominal cramping, nausea, vomiting, anorexia, or patient develop tachycardia, hypotension, fatigue, and finally lead to seizure. What is seizure? Involuntary movement of muscle, and finally coma or death, right? So as a nurses, what is our responsibilities, or what you should do if your patient has a hyponatremia? Definitely patient education is important, patient assessment is important. After the assessment, we have to planning within short time, and also after the planning go for implementation, and finally evaluation. And this is the nursing process, right? So assess the sign and symptom, monitor input output, monitor the laboratory test. I mean the range of sodium, is it within the normal range? Means within 136 to 145 milliequivalent per liter. If no, maybe hypo or hypernatremia. So if your patient habit caressing the food and also high fluid high in sodium because hyponatremia, also limit water intake is indicated or is prescription. So what else? The sign and symptom of hyponatremia. The patient who have hyponatremia they commonly present with tachycardia or muscle twitching or muscle weakness. Muscle twitching also hyponatremia, right? Both cases. Or patient develop postural hypotension. Postural hypotension means when patient change the posture, blood pressure go down, drop. If patient has a hypotension, what about their heart rate, tachycardia? Blood pressure drop, heart rate go up. Or dyspnea means shortness of breath or GIT upset and develop the edema if severe hypernatremia. So hypervolemia developed, or even if it is too severe, that times develop the disoriented convulsion or decrease the level of consciousness, LOC, level of consciousness. So as a RN or LPN, what is our responsibilities if we feel my patient have hyper or hyponatremia? Go and focus first hypernatremia, monitor the intake and output, same as here, and monitor the mental status because disorientation, confusion, level of consciousness. At the beginning, patient will be restlessness, disoriented about the time, place, right? Caressing the fluid as prescribed or restrict the intake of salt because hypernatremia. So now let me go the second pages here. Get a focus in hypocalcemia, right? So first of all, we are going to talk what are the normal function of calcium in the body. What are the food rich in calcium? We have to know. What are the sign of hypercalcemia? What are the sign of hypocalcemia, right? And also we have to know what are the normal level of calcium. So first of all, let me go see the normal range of calcium. First of all here, so normal range of calcium are like example 9, or some books said 8.5 to 10.5. Right here. So this is a normal range. It is the normal range, I said. So if anybody's calcium level less than 9 or 8.5, this is hypocalcemia. 9, it is the number, but unit is a milligram per dl. If anybody's calcium level is more than 10.5, this is hypercalcemia, 10.5 milligram per dl. So before to go the other sign and symptom, definitely we should know what are the normal body function of calcium. Everybody know that calcium are the most important component for bones and teeth formation. most important component. I said. So also they have a important rules for nerves and muscle function, and also they help clotting, blood clotting, right? Very important. So what are the source of calcium or dietary source, like, or food source? Basically the milk and milk product or dairy product, dark green vegetables or fortified food are the source of calcium. NCLEX board really like to ask the question from hypocalcemia. Due to some unknown reason, they super like it. Hyponatremia. What are the cause of hypocalcemia? The easy way to explain the most common causes of hypocalcemia are diarrhea or vitamin D deficiency. Vitamin D, I said. Or some of the patients like hypoparathyroidism, endocrine. These are cause of develop hypocalcemia. The hypocalcemia patient develop positive chopstick sign or torso sign. Positive torso sign, or I said chopstick sign. The picture you can see, this is the trousers sign, and the picture here you can see this is the positive chopstick sign. So as I told, here we go again. Let me read it. Hypocalcemia, the cause: surgical removal of the parathyroid glands. Surgical removal of parathyroid glands. Other medical conditions such as hypoparathyroid. So if patient have any thyroid disease, sometimes go for total thyroidectomy. Unfortunately, sometimes with the thyroid gland, the parathyroid gland also will be removed and problems start. Because the parathyroid is too small gland, they secrete the calcium. So if patient have a hypoparathyroidism or acute pancreatitis or hyperphosphatemia, thyroid cancer. So if thyroid cancer, need to remove the thyroid gland. When remove whole gland, chance of parathyroid gland also remove, and patient develop hypoparathyroidism. If patient develop hypoparathyroidism, calcium level go down and develop hypocalcemia. Or inadequate vitamin D intake. Vitamin D have a relationship with calcium. They help to convert. Malabsorption, hypomagnesemia, alkalosis, sepsis, or alcohol abuse. Hypercalcemia causes hypocalcemia, right? So sign and symptom. As I told you, the most common symptom, positive chopstick sign or trouser sign. Also, patient develop muscle spasm or develop numbness or tingling sensation in the extremity or tingling sensation in lips or finger, muscle tremor, cramping, okay, or GI upset, and also chance of develop cardiac dysarrhythmia like potassium, right? And also decrease the cardiac output. At the finally, patient will be get confused. So if patient have developed hypocalcemia, what is your responsibilities as a healthcare provider? We have to closely monitor the respiratory or cardiovascular status or initiate safety precautions to protect confused the client. Admin oral or parental calcium. If patient is unconscious, level of consciousness go down, don't give anything orally. Always better parental route. Also give IV administration and closely monitoring the cardiac function. So what else? Hypercalcemia. The most common cause of hypercalcemia are hyperparathyroidism, hypercalcemia, hyperparathyroidism, or long-term steroid use, or bone cancer. What wrote here? Prolonged immobilization. So if anybody like sedentary lifestyle, most of the times are sitting, not mobilized, immobilized, chance to develop hypercalcemia or hyperparathyroidism, but whatever here, hypoparathyroidism or malignancy of the bones, means bones cancer, right? Bone cancer can develop hypercalcemia. If anybody hypercalcemia, they have a risk of fracture, broken bones easily. Broken bones easily, I said. And here, what the sign symptom? If anybody have hypercalcemia, they complain at the beginning constipation, most common sign, or decrease the deep tendon reflex, decrease the deep tendon reflexes, or kidney stone, or pathological fracture, because high risks of broken or high risks of fracture is called pathological fracture, right? So what the other sign symptom? Lethargy, weakness, nausea, vomiting, hypercalciuria, means urea means calcium is in urine, and hypercalcemia means hypercalcium in the blood and hypercalcium in urine, right? So what the nursing intervention if patient develop hypercalcemia? First of all, increase the client movement, because immobilization is one of the cause of hypercalcemia. Increase the client movement and exercise. Encouraging oral fluid. Teach the client to limit intake of food and fluid high in calcium. Just recap it. What are the source of food contain calcium? Milk and milk product or dairy product, dark green vegetables or fortified food. So tell them to take milk and milk product less, increase the fiber content food, protect confused client, monitor the pathological fracture, encouraging intake of acid as fluid. What it is means like um, berry juice, all kind of berries, right? It's counteract deposit of calcium. Also, assess for receiving any other, like I said, assess for the client to receiving digitalis for digital toxicity, digoxin or hypercalcemia increases the risk of toxicity. So this is very important information about the calcium. So here now we has to talk about the potassium. So what is the normal function of potassium, or what are the food rich in potassium? What are the sign and symptom of hyperkalemia, hypokalemia? We supposed to talk all of this. So potassium, right? So the normal body function of potassium, they maintain intracellular fluid, and also they are important for nerve function or regulate the muscle and heart contraction, right? So let me recap it for you. I said the function of the potassium are maintain the intracellular fluid, nerve function, regulate the muscle and heart contraction. The normal source of the potassium are like some food, banana, potato, tomato, some organ, cantaloupe, avocado, or dark green vegetables. Very important. So the normal range of potassium are 3.5, like 3.5 to 5, right? 3.5 to 5. So 3.5 to 5 milliequivalent per liter at the unit. So if my body potassium level is less than 3.5, you can say hypokalemia. If the potassium level more than 5 milliequivalent per liter, you can say hyperkalemia. Both are bad. Both develop dysarrhythmias, and dysarrhythmia develop heart fail and patient die, right? So what are the causes of hypokalemia? Frequently asking both question, my friend. Like GI losses, gastrointestinal loss. What are the cause of gastrointestinal losses? Like vomiting or gastric suction or diarrhea, gastric losses. Some diuretics like potassium wasting drugs, diuretics, or metabolic alkalosis. Metabolic alkalosis causes hypokalemia, because when vomiting develop the metabolic alkalosis, both lead to hypokalemia, and hypokalemia lead to dysarrhythmia, and dysarrhythmia lead to heart failure and patient die. right? Or if anybody poor intake of potassium containing food, or if anybody is alcoholic, anorexia nervosa. So what are the symptom or sign of hypokalemia? Symptom, I said, most important, cardiac dysrhythmia. What is lead to VTAC or VFib means ventricular tachycardia or ventricular fibrillation or flutter, right? Okay. So others problem are muscle weakness and muscle cramping, or patient develop the constipation, like the hypercalcemia also develop constipation, fatigue, lethargy, anorexia, GI upset like nausea and vomiting, decrease the bowel sound, decrease the bowel mobilities, and depressed the deep tendon reflexes. Decrease the deep tendon reflexes, right? So here we go. Next, the ABZ may show. Yeah, what is ABZ? Arterial blood gas analysis may show alkalosis, metabolic alkalosis, right? If you take the EKG or ECG, we can see the ST segment flattened or T segment not upright, flat. ST segment depressed, but ST segment should be up or positive deflection, and also prominent U waves. Now go, what are the our intervention as a nurses? What you have to do about this? Monitoring the heart function or rhythm means patient develop chance of develop the dysarrhythmias, right? Patient develop dysarrhythmia, the chance. So monitor the client receiving digoxin closely, because hypokalemia increases the risk of digital toxicity. Let me explain. Some of the patient, because of heart failure, doctor prescribe the digoxin or digitalis. So if patient have the hypokalemia, the digoxin toxicity chance of increase the risks of digital toxicity, because digitalis or digoxin has a very low therapeutic index. Give the oral potassium because of hypokalemia. Admin IV potassium solution at rate no faster than 10 to 20 milliequivalent per hour. You see, IV for solution no faster, important. We have to dilute it and teach the client about the potassium rich food and teach the client how to prevent excess loss of potassium. Now go and focus hyperkalemia. So cause of hyperkalemia, most common cause are uncontrolled diabetic ketoacidosis, shortly called DKA, right? DKA, diabetic ketoacidosis. So diabetic ketoacidosis patient chance of develop hyperkalemia. So uncontrolled diabetic or metabolic acidosis or salt substitute or kidney failure. You say renal failure, potassium sparing diuretics. Potassium sparing means something reabsorbed, kept, don't lose, take it out. High potassium intake or excess use of salt substitute are the cause of hyperkalemia. As like hypokalemia, hypercalcemia patient also easily develop cardiac dysarrhythmias, right? Cardiac dysarrhythmias. Muscle weakness, like before hypokalemia, muscle weakness or muscle numbness, tingling sensation, or diarrhea and confusion. So what else? What is our responsibility or intervention? Closely monitor for cardiac arrest, like here, closely monitoring. Both cases, chance of develop dysarrhythmia. Admin diuretics or other medication such as glucose or insulin is prescribed, because decay is one of the important cause of develop hypercalcemia. So we have to treatment of decay, monitor the serum potassium level and teach the client to avoid the food high in potassium or salt supplement. So what next? Next, we have to talk about the magnesium. Okay, very important about this magnesium. But some of the book talk about the chloride. Chloride is important as well, and phosphorus also. So here I said the hypomagnesemia, right? Hypomagnesemia. So if the patient magnesium is lower than normal, develop hypomagnesemia. Hypomagnesemia, when we read, always keep in mind what we know about hyper and hypocalcemia. The hypomagnesemia sign and symptom almost same with hypocalcemia, right? So first of all, what are the cause of hypomagnesemia? Excessive loss from gastrointestinal tract or GI losses, nasogastric suction, diarrhea, or fistula drainage loss, or long-term use of certain drugs like diuretics or aminoglycoside antibiotics. Cause of hypomagnesemia. Could you remember what are the causes of hypocalcemia? They also GI losses like diarrhea or hypoparathyroidism or vitamin D deficiency. Hypocalcemia or hypomagnesemia both causes the positive chopstick sign or positive transverse sign. Both can cause muscle spasm or tingling sensation, neuromuscular irritabilities, tremor. Okay. And the magnesium can cause cardiac arrhythmias or dysarrhythmias like hypocalcemia or hypokalemia, hypokalemia or hyperkalemia, both causes cardiac dysarrhythmia like hypomagnesemia arrhythmias. Also causes tetany. The hypocalcemia also causes tetany. Tetany or tetany are the involuntary movement of muscle, right? The seizure also the involuntary movement of muscle. So in that cases, we has to be care of the patient, very important. So if your patient has a hypomagnesemia, always access the client receiving the digit. We has to take the history. Patient has to take or do not take the digitalis or digoxin, because hypomagnesemia has a chance of develop digoxin toxicities, increase the risks of the toxicity, or protect the patient from injury or seizure precursor. It is important patient education, right? If patient has a seizure, safety precursor is most important. After the seizure, we take the vital sign, perform the neurological check, reorient the patient, identify the possible trigger why seizure developed, or implement the seizure precursor like side rail or bed pad rail. It's important for NCLEX board. Hypermagnesemia. Hypermagnesemia. Conditions such as, what are the conditions of hypermagnesemia? Like renal impairment, DKA, right? DKA. DKA when another times also develop DKA. Hyperkalemia, DKA. Diabetic ketoacidosis, dehydration, hypothyroidism, Addison disease causes hypermagnesemia. Use for long time antacid or laxatives contain magnesium, right? So it is antacid, magnesium containing antacid. Hypermagnesemia causes neurological depression, cardiac muscle depression, and arrhythmia. Same here also arrhythmias. Hyperkalemia develop arrhythmia. Hypokalemia develop arrhythmia. Hypomagnesemia develop arrhythmias. Hypermagnesemia develop arrhythmias. And nausea, vomiting, central nervous system depression like lethargy, bradycardia, and hypotension. So what is our responsibilities, right? Our responsibilities are initiate the safety precursor, monitoring blood pressure, pulse rate, respiratory rate, and also admin the calcium gluconate. It is super important. All is important for NCLEX board. Calcium gluconate. Also, it is the drug of choice. Treatment the patient with the renal disorder to avoid the preparation containing the magnesium. Before to finish this chapter, let me explain a little bit about the phosphorus. Phosphorus, we write like this, okay? There are 3 positive here, phosphorus. So the function of phosphorus in the body, their important component, bones and threads formation, like calcium. The source of the phosphorus are the food, basically dairy product. including cheese or dark green vegetables, meat, fish, eggs, right, and some legumes or beans. So always keep in mind the phosphorus has an inverse relationship between calcium and phosphorus. Let me explain, recap it. There are inverse relationship between calcium and phosphorus. Means if the calcium level go up, phosphorus level supposed to go down, right? This is called inverse relationships. Or if the calcium level go down, phosphorus level go up, inverse proportion. So there are inverse relationship between calcium and phosphorus. If the calcium is high, phosphorus is low, or vice versa. Means if the calcium is low, phosphorus is high. Important, right? So if patient develop hyperphosphatemia, so the normal range, but first of all, we have to know what are the normal range of phosphorus. The normal range of phosphorus, 3 to 4.5, 4.5 milligram per dl. If the phosphorus level is more than 4.5 milligram per dl, we can say hyperphosphatemia. Hyperphosphatemia, as I said. So in that cases, here the sign of hyperphosphatemia, usually the patient, if the patient have a hypocalcemia, they have a chance of develop hyperphosphatemia. So what are the sign and symptom of hypocalcemia? It would be the sign of hyperphosphatemias, right? Because when calcium level go down, phosphorus level go up. So what are the sign and symptom of hypocalcemia? It is the sign and symptom of hyperphosphatemia. Like hyperphosphatemia patient has a positive chopstick sign or trouser sign, muscle cramping, tingling, sensation in the extremities, or lips and fingers. Okay, so another most important electrolyte we use, that one is chloride, shortly called Cl. Chloride. Chloride, normal body function chloride are they help to digestion or maintain the intracellular fluid or extracellular fluid. The major source of the chloride are salt. Okay, salt. And hyperchloremia, when occur, the sign symptom is a nausea and vomiting. When the chloride level is go down, is called hypochloremia. And hypochloremia patient develop muscle cramping and GI upset. This is very important information regarding the electrolyte imbalance, what we have to know.